Good day, listeners. Today, we are going to discuss Lassa fever virus infection in pregnancy. I am Justice Ndulu Eze. Learning objectives. At the end of this presentation, the listener should have learned about the epidemiology and mode of transmission of Lassa fever virus and the clinical features or clinical presentation, the pregnancy outcomes, and the diagnosis of Lassa fever virus infection, as well as the mode of treatment and prevention of Lassa fever virus infection. For introduction, Lassa fever virus belongs to the Arenaviridae family of viruses. Its genome has two single ribonucleic acid strands. Lassa fever virus infection is associated with acute viral hemorrhagic fever that is highly fatal, and in pregnancy is associated with adverse outcomes. It has been known for about 6 decades now and was first described in a small town called Lassa in the present-day Borno state in northeast Nigeria. Epidemiologically, Lassa fever is endemic in West African countries, as shown in this picture, this map. Nigeria is one of the countries affected. About 400,000 cases, new cases are seen annually, and cases are associated with high fatality. Nigeria, in some states in Nigeria have reported outbreaks in recent times. Ebonyi is one of such states, and outbreaks have been reported with a prevalence of 25.7%. Transmission of Lassa fever. The reservoir for the virus is the multi-mammate rat, Mystomis natalensis. It has unique features. It has multiple mammary glands on its underside, ventral side. This rat is ubiquitous. It's seen almost everywhere. Infected rats shed the virus in their feces and urine and continue to shed it for the whole of their lives. Primary infection occurs when human beings are infected by contaminated food items and utensils. Food items and utensils on which the rat has deposited its excreta. Secondary infection occurs through the body fluid of infected individuals to other individuals. So it's person to person infection. Mother to child infection may also occur in utero or during breastfeeding. Only about 20% of exposed cases develop symptoms. Clinical features. The incubation period of Lassa fever virus infection is 2 to 21 days. It starts as an acute onset of non-specific symptoms as seen in common causes of fever, febrile illnesses like malaria, typhoid fever, Ebola, yellow fever, Marburg, and so forth. And it's so fatal that it kills within 14 days. Fatality of 15% has been reported in hospitalized cases. About 25% of those who survive the infection develop deafness, and up to 50% of survivors develop partial hearing loss. Recovery usually takes about 1 to 3 months. There is also transient hair loss and gait disturbances reported in survivors. Lassa fever and pregnancy. It is hard or difficult to differentiate Lassa fever infection in pregnancy from infection by the common causes of febrile illnesses. Lassa fever infection is associated in pregnancy is associated with high maternal and fetal stroke perinatal and neonatal morbidities. Early pregnancy infections mimic ectopic pregnancies and spontaneous miscarriages and is associated with bleeding, pregnancy losses, anemia, and maternal demise if not appropriately managed. Late pregnancies can be very severe from second trimesters and third trimesters. Maternal and fetal deaths occur in third trimester infections. Maternal case fatality may approach is even more than 80%, and perinatal mortality of approximately 90% have been reported. Neonatal mortality is in the neighborhood of 100%, although more recently, successful cases surviving late infections have been reported. Negative pregnancy outcomes seen are thought to result from the high viral load associated with lowered immunity, maternal immunity in pregnancy, sequestration of virus in highly vascular placental tissue, as well as low fetal immunity. Diagnosis of Lassa fever. The diagnosis of Lassa fever is done by the identification of the antigen by the use of reverse transcriptase polymerase chain reaction tests on blood samples. Testing should be done in dedicated lab, and handling of specimens must be very careful to avoid contamination and infection. Enzyme-linked immunosorbent assay also can be used for diagnosis making, although it's costly. It detects immunoglobulin M and immunoglobulin G as well as viral antigen. Cell cultures and immunochemistries are also useful. Treatment. The treatment of Lassa fever is usually supportive. Supportive care will prevent and correct fluid and electrolyte imbalance, control fever, control vomiting, prevent or control diarrhea, provide oxygen for the patient, and provide psychotherapy. Supportive care will help prevent and forestall things like acute kidney injury, which is one of the main causes of morbidity and mortality. Also, ribavirin is a broad spectrum antiretroviral medication that is known to reduce Lassa fever mortality and fatality from 55% to 5%. Provision of obstetric care when necessary and gynecological care as the need arises based on the gestational age is also part of the management of Lassa fever in pregnancy. Also, the application of infection prevention and control measures by healthcare workers will reduce nosocomial infection and make sure that none of them succumbs to Lassa fever in pregnancy while taking care of the sick. Prevention. Prevention of Lassa fever reduces its ravaging effects, and prevention can be by good community hygiene, which will forestall rats from getting into houses and defecating and urinating on food items and utensils. The use of rodent-proof containers for storage of food items will also prevent urination and defecating on these food items and thereby reduce contamination of human food and causing infection. The proper disposal of refuse will ensure that rodents don't far away from home. Will ensure that rodents don't get to these homes and disseminate infection. Then application of standard infection and prevention and control measures will reduce the infection of individuals. Key points. Lassa fever virus infection causes an acute hemorrhagic fever, and it cannot be distinguished from common causes of fever. It is epidemic prone and notifiable. In pregnancy, there is high maternal and perinatal risks, and early presentation, supportive care, and ribavirin therapy are yielding successful outcomes for mothers, pregnancies, and infants. Prevention uh, by good community hygiene, use of rodent-proof containers, proper refuse disposal, and application of standard infection prevention and control measures will help contain Lassa fever. Thank you for listening. Questions will be addressed. Thank you.